Hello! Welcome to medical school. Today we're going to talk about POCUS and how it is incorporated into your curriculum.
What's POCUS?
POCUS is an acronym that stands for Point of Care Ultrasound, one of the many acronyms you will have the pleasure of learning over the next 4 years.
I've heard of ultrasound, but how does it work?
Ultrasound is an imaging method that uses sound waves produced by a probe placed onto an area of the body. These sound waves then bounce back to the probe in different ways depending on the tissues they encounter. The different characteristics of these reflected sound waves are then used to make an image on the ultrasound screen.
So, what makes POCUS different from regular ultrasound?
POCUS is a handheld ultrasound device that can be carried in your pocket to the patient. It can be used to visualize various physiologic and pathologic states in the body in a fast, effective, convenient, and low-cost way. This is different from a formal ultrasound study because it is performed and interpreted in real time by the physician when they are seeing the patient. A formal study is ordered and then performed later by a sonographer, either at the bedside or in a radiology suite. These formal studies often come with a significant price tag too, $40 to $50 copay, all the way up to as much as a few $1,000s without insurance.
How will POCUS impact the way clinicians practice medicine?
In many ways, POCUS is becoming an extension of the physical exam, like the stethoscope. It is another tool that clinicians can use at the bedside during a physical exam to identify pathology and promptly offer a plan of treatment afterward.
What are some examples of how POCUS is used?
POCUS can be used by almost every specialty in medicine, both outpatient and inpatient. Some examples are ruling out a DVT by an EM physician, screening an aorta in a family medicine office, looking at a kidney in a nephrologist's office, all the way to examining a patient's lung in the ICU.
What does POCUS look like in Indiana and how often is it used?
POCUS is becoming a widely accepted clinical tool in many medical centers. In Indiana, outside of obstetrics, musculoskeletal applications, and emergency medicine, POCUS isn't used as much outside of the academic centers yet. However, many clinicians are getting additional training to improve their skill and increase patient access to this imaging technique. Also, by introducing POCUS to medical students here at IU, the number of physicians familiar with using this technology will increase over time.
What does a POCUS curriculum look like here?
POCUS is incorporated early in our education to help students learn anatomy, physiology, and pathology in a more dynamic way. We gain skills progressively through all 4 years, as shown by the scaffolding approach.
How does a curriculum closely match the materials we're learning in other courses?
POCUS sessions are scheduled in the Foundations of Clinical Practice course throughout the semester and closely match their curriculum. The sessions may also match and reinforce what you're learning in your basic science or UDOS courses. These sessions are hands-on and practice-based, lasting anywhere from 25 minutes to 1 hour, depending on your campus.
How are we tested on this?
Over the next 4 years, your knowledge using POCUS will be tested through short pre-session quizzes on Canvas, as well as in-person assessments at the end of FCP. There's also an evaluation at the end of Phase 2 as a portion of the clinical performance exam.
How does POCUS benefit our education?
Many schools have ultrasound or POCUS student interest groups, which they utilize to teach ultrasound, but few have a formal curriculum. IU is one of only 10 medical schools to have formally integrated POCUS into a longitudinal 4-year curriculum. Additionally, POCUS is taught at IU by renowned faculty along with student-led activities, in comparison to other institutions where it's only taught by student-led clubs.
How does POCUS impact our careers long term?
POCUS is a skill that gives you an edge as you move into residency and clinical practice. Being familiar and proficient in POCUS can be an additional skill you can utilize to market yourself to programs when it comes time to apply to residency. If you're interested in academics, you can use your POCUS knowledge to build a program elsewhere during residency or in clinical practice. Ultimately, It gives you, the clinician, another clinical tool to provide high-quality care to your patients.
What resources can help us prepare for POCUS assessments?
There are several online and on-campus resources to learn, practice, and feel more comfortable with POCUS. These can be found on the Canvas site and MedNet. While each IUSM campus has similar resources, the equipment checkout process may look different depending on which campus you're at. Every student is allowed to check out equipment for practice outside of class. You can find information on days, times, and access the sign-up form for your campus on the MedNet website. Check out the links using the QR codes to find the POCUS MedNet page and the Canvas course page to find more campus-specific resources. Check with your local leaders to see if your campus has an area you can reserve for practice.